Journalists have been called upon to be abreast with necessary capacity to report gender-based violence. Chairman, Nigerian Union of Journalists FCT Council, Mr. Emmanuel Ogbeche, made the call at a gender-based violence and health sensitization program organized for women journalists in Abuja. Holina Adojo reports.
According to a UN report, 1 out of 3 women experience one form of gender-based violence in a lifetime. This is coming at the heels of an increase in gender-based violence targeted at women and children, who are the most vulnerable in the society. As a result of the escalation, stakeholders and relevant agencies have advocated for more sensitization to reduce the UN-tagged shadow pandemic. Speaking at the event, Chairman, Nigerian Union of Journalists FCT Council, Mr. Emmanuel Ogbeche, said patriarchy, which emphasizes male dominance, affects women. He advocated for women inclusion and empowerment, adding that journalists should understand how to report gender-based violence without ambiguity.
That as journalists, you have an understanding of terms and terminologies when reporting sexual and gender-based violence. If you do not, the tendency is to victimize the victims. When you report on SGBV, it is also important that your sources, except when there is threat to life, should not be anonymous. Except when there is threat to life. The believability of your report is in acknowledging the source. You know, that is why I find it very difficult when a victim says, I don't want to be known. You know the danger of not wanting to be known. It emboldens the abuser.
In her submission, Chairperson, Nigerian Union of Journalists, FCT chapter, Mrs. Anna Daniel, emphasized the need for intervention that can promote good health in order to prevent household emergencies such as gender-based violence.
We are all lending our voices, our collective voices, to condemn this menace in totality and calling for positive political will by policymakers to ensure that perpetrators are being punished and victims are being compensated.
The sensitization program, which was necessitated by lack of awareness and silence in the face of rising cases of gender-based violence, mental health, and general well-being, had contributions from critical stakeholders.
I can tell you that not up to 10% of incidents of gender-based violence get to be reported. So there's a lot of work to do.
And the consequences of negative media image for people who have mental illness are so profound. Number one, they impair self-esteem. Each time we hear this negative, portrayal from the media, it's impair their self-esteem. It's also impair help-seeking behaviors.
We should keep our blood pressure in check. In case there is a known case of hypertension in anyone's family, we need to regularly check because hypertension is one of the causes of chronic kidney disease.
The event tagged Health for Maximum Productivity, Together We Can, was organized by Supporting Hands Initiative in collaboration with NAWOJ FCT, Report Women, a news and newsroom engagement program of Wole Soyinka Center for Investigative Journalism, and with support by T.Y. Danjuma Foundation. Holina Adojo, ASO TV News.